My name is Thomas Lyons. I'm an orthopedic surgeon here in New Orleans. I'm a native New Orleanian. I went to Tulane Medical School and did my residency also at Tulane. Following my residency, I did a fellowship in arthroscopic surgery. I learned the latest techniques in shoulder and knee arthroscopy, and that is the bulk of my practice is shoulder and knee conditions. I've been in practice here at the Orthopedic Center for 12 years and in practice in the New Orleans area for about 16 years. I chose orthopedic surgery even before I started med school. I visited with a friend of my father's who's an orthopedic surgeon at Truro, and I saw him do a hip replacement, and I thought it was the most fascinating, neatest thing I'd ever seen, and I thought, I think I'd like to do that. And so I pursued that from the beginning. And it's been a very rewarding career. We get to have a positive impact on people's lives and help them in a way that we don't get to do in many other fields. Shoulder conditions represent a huge part of our practice, from young kids that sustain sports injuries, athletic injuries, and come in with instability complaints, to the older, middle-aged people that predominantly come in with rotator cuff disorders or arthritic conditions of the shoulder. We are able to evaluate them here in the office, perform MRIs here in the office, initiate conservative treatment consisting of medications, injections, physical therapy here in the office, and when necessary, perform the latest cutting-edge arthroscopic surgical techniques to remedy their problem. Rotator cuff disorders represent the most common shoulder condition that affects adults that we see here at our clinic. It varies from an inflammatory, degenerative, early partial tear type condition through a full thickness detachment of the rotator cuff from the insertion on the humeral head. The rotator cuff is a set of 4 tendons that covers the ball and socket of the shoulder. It controls shoulder rotation and motion and holds it in its position in the socket of the shoulder. Rotator cuff conditions are very common and can be treated in large part by conservative measures, including medications, injections, and physical therapy. When those conservative measures fail, then we discuss surgical options. The recovery time from a shoulder arthroscopy depends on the exact procedure performed. It can take some time. For example, if a rotator cuff tendon is torn and requires repair, the patient requires a period of immobilization and an arm sling, after which therapy is started. The recovery time is measured in months rather than weeks, but the success rates are very high, and people regain function and strength in their shoulder and get a pain-free shoulder following surgery.